So, Paul, you've been in Kelowna for about 7 years, I think. Tell us how you got to Kelowna.
So I've been a faculty member at UBC Okanagan for 7 years, and before that I was a faculty member at the University of Oregon down in the States for 15 years. But I'm originally from Canada. I grew up in Quesnel in central BC, and then did my undergrad and a master's at UBC Vancouver, a PhD at the University of Calgary, and then I was in Europe for a few years doing postdoctoral research, and then eventually wound up in Oregon, and then made my way here.
Was it a job offer to work at the university that attracted you to Kelowna? And did you know about Kelowna before you came here?
Yeah, it was a job that I applied for. I knew some of the people that were at UBC Okanagan already, just from my past work. And so when I heard about the fact that it was becoming UBCO, I started making inquiries, and then a job became available that I applied for, and I was fortunate enough to get.
So tell us about your studies. What did you take in school, and did it change much from undergrad to master's to PhD?
Yes, is the short answer to that. So I'm interested in how the brain works or doesn't work to control movement. So it's sensory motor control is the area of study. And I've used a variety of tools and techniques over the years. And for the past 10 or 15 years, I've been interested in traumatic brain injury. So when a person gets a concussion, for example, what happens in terms of their ability to control movement and other factors related to how the brain functions after that injury. And then for the past couple of years, been collaborating with my partner, Karen Mason from the Kelowna Women's Shelter, looking at traumatic brain injury and survivors of intimate partner violence, which is a completely understudied area right now.
So tell us briefly, how does brain injuries reflect in a person's demeanor and behavior?
Yeah, the kind of clinical anecdote is if you've seen one concussion or brain injury, you've seen one concussion or brain injury. So it can be different from one person to the next. The main symptom in a sports-related concussion, for example, are things like headache, difficulty concentrating, being in a fog. Sometimes you can get sensory deficits like ringing in the ears or dizziness. And so the main kind of outcome is it can be debilitating, and it's a difficult injury to diagnose. You can't make a X-ray and see that a person has a brain injury unless it's a very severe one, and then you don't really need the X-ray because they have a lot of other deficits. But with something more minor like a sports concussion, quite often it's really hard to tell that they've had the injury, but they know that something's not right.
So how do you tell with a sports injury? I guess there's a series of tests they have to go through. Tell us basically the process before you can say, okay, conclusively, that's what's happening.
So the main two things that happen are that within the context of at least contact sports like hockey and football, you can quite often see the injury happen. So a player gets hit and they're maybe knocked out on the ice potentially, although they don't have to be unconscious. They have difficulty getting to their feet. They're dizzy or unstable in terms of their balance. You can ask a series of questions fairly quickly and do some fairly quick kind of sideline assessments to ask them, what day is it? Where are you? What's happening? And if they don't answer those questions really, really quickly, then you can suspect that they've probably suffered a concussion. So then you can do follow-up testing that's more detailed, sometimes using a computer to do neuropsychological assessments of things like attention and concentration and memory. So it's those combinations, those series of tools that you use to make the diagnosis.
Please correct me if I'm wrong, but I think a lot of people have a misconception about sports injuries and concussions. I believed when I was younger that a concussion comes from a direct blow to the head only, but it's true that a very strong body check, for example, in hockey, where the head is not contacted directly, could also create a concussion. Is that true?
Yeah, so you can get a hit to the body that decelerates your body, and your head on top of your body will continue to move, and your brain within your head will also continue to move until it comes to a stop. So in those cases, your head and your brain don't get directly impacted, but the forces that are transmitted to your body get transmitted into your brain. Same thing happens, for example, in a car accident, a head-on collision where the seatbelt restrains you, so your body stops, but your head keeps on moving. Right. And so that deceleration is the key injury mechanism there.
How bad is it in sports? And is it mostly football and hockey where we see these injuries, or is it all kinds of sports?
Yeah, I think it's 10 to 15 to 20% in contact sports each year will end up getting a concussion. Wow. So it's really high. In other sports, soccer, women's lacrosse is really bad because they don't wear protective gear. Volleyball, basketball, you can get incidental contact that can lead to a concussion. So it's definitely more prevalent, kind of on a per capita basis in things like hockey and football, because contact is part of the game. It's an allowed part of the game. Obviously, we're better now at constraining it somewhat, so that boarding, for example, hitting from behind in football don't hit a defenseless player. And so new rules have come into effect in the last few years that have reduced the incidence of it. On a kind of per exposure basis, it's surprising that sports like soccer and, like I said, women's lacrosse, cheerleading is another one where, especially the female cheerleaders are getting thrown all over the place, and sometimes they miss the landings, right? And so they can result in a concussion. So those sports are ones where the kind of amount of practice or the amount of time that you do relative to the amount of injuries that occur are actually relatively high, even though the actual absolute numbers of people getting concussions are not that large.
So your work, are you mainly researching and bringing awareness, or are there ways to treat concussions? Like, tell us about what you do at the university.
The main work we're doing is lab-based assessments of concussions. So we're looking at better objective means of determining that a concussion has occurred. So right now, really the kind of best clinical practice is you see the injury happen, and then you do assessments of a person's symptoms. Ask them about a headache, ask them about dizziness or nausea, for example. And there can be biases introduced in those subjective reports, right? So a young hockey player who doesn't want to, wants to keep on playing, well, when you ask them, have you got a headache? Do you feel dizzy? They'll say, no, I'm fine. I mean, not all the time, but sometimes people will do that if they want to keep on playing. The converse, for example, is someone who has potentially a workplace injury or a car accident, and you ask them, do you still have a headache, or do you still feel nauseous or dizzy from your brain injury? They could say, yeah, absolutely. And because it's subjective, you don't know for sure, right? And that may be used in litigation. And so most concussion research and brain injury research is aimed at trying to come up with tests that are more objective in terms of whether the injury happened and how the person is recovering from the injury over time.
Can a concussion always be cured?
Yes. Most of the time, recovery occurs. They say about 85 to 90% of people that get a mild concussion, say in the context of a hockey game or a soccer game, will be fine within about a week to 10 days. There's what they are calling in the literature the silent minority, which are people that suffer from what's called post-concussion syndrome. Mm-hmm. So these are people that have lingering deficits, sometimes weeks, months, years after the injury. And so they'll end up having those symptoms that just keep on sticking with them. You asked me before about what's the treatment. The kind of current kind of traditional clinical treatment is rest, complete cognitive and physical rest. And for the past 10 or 15 years or so, that's been kind of the mantra of anyone that treats someone with a concussion is go home and rest. Don't use your brain. Don't think too much. And That's starting to be rethought now. It turns out that if you take someone who hasn't had a concussion and you tell them, go home, sit in a dark room and don't do anything for a week, they end up feeling not so good after that time, right? So it's maybe not the best treatment. It's worse than the disease in this or the injury. And so there's some recent research that's looked at the idea of active physical rehabilitation. So moderate physical activity on an exercise bike or a treadmill, for example, to kind of reset some of the physiology in the brain. And that's been shown to actually be quite effective. So a lot of sports concussion specialists now are rethinking what to do in terms of rehabilitation and to include the active physical component actually sometimes within a day or two after the injury.
What is a concussion? Like what is actually happening? I understand that you talked about velocity or impact, and the brain is crashing against the skull basically. And what happens to the brain? Like what is the cause of these symptoms?
It's maybe a little bit too simple to say it's crashing against the inside of the skull. It's probably the more realistic thing to say is that the brain is rotating and twisting. It doesn't absolutely have to hit the inside of the skull. And in fact, if it does, you probably end up with a brain contusion, which can be a more severe, result in more severe injury. So just the twisting and the shearing of the brain tissue leads to the injury itself. So it's the deceleration and the rotation of the brain within the skull that is the mechanical impetus for the injury. And so that leads to those tissues not working, not being able to do their function as well. So if you think about what those tissues are, well, it's neurons, which carry all the signals. It's astrocytes, which are another form of brain cell, which basically provide support to the neurons. And then it's the cerebral vasculature, the blood supply into the brain. And so in each case, when those tissues get damaged or disrupted, they're not able to do what they normally do. So neurons, their normal job is to carry signals from one part of the brain to the other. Right. It's how we think, it's how we perceive, it's how we move, it's everything. And so if you think about just the simple act of reaching out and picking up your coffee cup, that requires really exquisite, precise timing of tens of thousands, if not millions of neurons all working in a coordinated fashion to get the muscles of our arm and hand to be coordinated to make that movement and be successful in terms of picking up that coffee cup. So if a bunch of those neurons are now no longer firing properly, or they're doing so less consistently, then the act of doing that becomes more of a challenge.
Right.
And so you get a little bit slower at it or sluggish at it or less accurate at it. And that applies to all the different functions in the brain because basically the whole brain is affected by it. Some of the work that we're doing at UBCO looks at the cerebral vascular side of things, so the blood flow into the brain. Because again, these are tissues that are going to be exposed to the force and potentially disrupted in terms of their function. Yeah. Now, the blood supplies oxygen and glucose and nutrients to the neurons to be able to do their job. So if the blood supply is disrupted, then the ability to feed the neurons so that they can do their job is also going to be disrupted. And so some of the research we've been doing the last few years has shown that that's indeed the case, that the blood flow into the brain isn't working as normally as it would. And so you get symptoms that result from that are consistent with the brain injury.
Luke Mankus is a realtor with RE/MAX Kelowna. He loves what he does. We asked Luke if he had any regrets about moving here in 2011. And he always says, yeah, one regret, and that is he didn't move here sooner. When Luke came here, he didn't know anyone. He didn't know the neighborhoods or anything or anyone besides his daughter, who was 6 years old at the time. So he knows what it's like. Now, he's an expert and has helped well over 100 single people, couples, families, and investors with their real estate needs in the Okanagan. If you're new to our beautiful city, Luke can help you get connected with great lawyers, dentists, carpenters, landscapers, swimming pool installers, you name it. And whether you're new to Kelowna or not, Luke knows real estate. He can help you find a great property, negotiate a good deal, and hold your hand all the way through the process until the day you get your shiny new set of keys. Luke is known as a no-pressure kind of guy. He's had clients where it took even a year or more to get them into a property. He just doesn't believe in rushing things. On the other hand, when you decide it's time to act, he's diligent and he'll work day and night until the job is done. Give Luke Mankus a call or a text message at any time. 778-215-4273. Again, that's 778-215-4273. 778-215-4273 to chat with Luke about real estate.
Just going back to what you said, the previous way of thinking that even mental activity could be harmful, and we're getting away from that kind of thinking. What was the rationale? Like, what did doctors think would happen if you exerted your mental faculties too strenuously after a concussion?
I mean, I think it's the same principle as, you sprain your ankle, you don't go out and go for a long run right afterwards, right? You rest it, you rest it, you put ice on it, you compress it, and you elevate it, right? Those are the RICE acronym. So it's analogous to that. And yeah, mental activity, just thinking, I think a lot of young athletes go, oh, I got a concussion, I'll just go and play video games for a couple days. And well, no, because that's an incredible mental stress. It uses a lot of different neurons that are potentially injured. So I think the idea was that you need to rest those tissues in order for them to recover. And most of it was probably based on, there's animal models of brain injury where an injury is induced, and you can go in and actually look at the extent of the damage in the brain of these, mice or rats typically. And but those injuries and the ways in which they're induced tend to be a lot more severe than what happens in a kid who gets hit hard in a hockey game, for example. And so it's maybe not fair to draw the analogy between some of the things that were being seen in some of the animal models versus what happens to humans in everyday life. So this newer idea of, take a day, maybe 2 days off, and then start introducing some physical activity to the extent that you can tolerate it. One of the things that happens when someone who's had a concussion participates in physical activity is their symptoms actually tend to get a little bit worse. So let's say their headache might start to get a bit worse if they get on an exercise bike and ride for 10 or 15 minutes. And so in these new protocols, they're talking about doing moderate exercise that pushes it a little bit, but not so much that the person starts to feel a lot worse. Right. And so, and the idea is that you just do that over and over the course of a few weeks. And like I said, there's some good evidence that it's actually pretty effective in terms of recovery happening more quickly, and maybe more importantly, in people that have post-concussion syndrome where the symptoms have lingered, actually getting over that and getting reductions in those symptoms, or actually being free of those symptoms after a month or so of this moderate activity.
Would it be sort of analogous to someone spraining their ankle and you want to rest for a while, but eventually you need some physiotherapy, you need to start getting blood flowing to that area so it can heal? Because if you just rest forever, it's never going to heal. So there is a period of rest, but you want to put some strain on it gradually over time. Is that kind of similar?
That's exactly right. If you sprain your ankle and then you never use your, the muscles about your ankle again, you're going to get atrophy, and you're going to, pretty soon have trouble moving your ankle joint. So yes, anyone who's gone through any sort of orthopedic surgery or any sort of injury to the joints will know that, yes, you have to immobilize it probably for some period of time, let that initial healing take place, but then get into the therapy, which can quite often be quite painful, right? Yeah. Because you're rebuilding the strength and the functionality of that joint. So it's quite analogous to that with the brain as well.
So your partner, Karen Mason, with the Kelowna Women's Shelter, told me that you guys are doing work together, and that surprised me when I heard about it. So I said I would ask you about it. So how does your work relate to the Kelowna Women's Shelter?
So yeah, this is a project that we've been working on for a couple of years now, and it kind of was catalyzed by an editorial that Karen came across in the LA Times, which was from a ED at a women's shelter down in Phoenix, who described basically the challenges that her own mother faced in an abusive relationship, and many of the symptoms that her mother had that looked a lot like what you see in athletes who get concussions, and in particular in ex football players and hockey players who've played contact sports for a long time and have difficulties later in life in terms of their mental function and some of the challenges they have with personality. So the resulting syndrome has been called chronic traumatic encephalopathy, or CTE. And there's some very good evidence that a lot of former football and hockey players who've been exposed to a lot of head impacts are likely suffering from CTE. And so drawing the analogy between what happens in players who play a contact sport and in survivors of intimate partner violence, where quite often the head is the target of the violence, it kind of makes a light bulb go off and go, oh, yeah, of course. This may be some of the same things that are happening chronically in former football players and hockey players might be happening in women who've experienced intimate partner violence. And so we started talking about it, and I started looking in the research literature to see if anything had been done, and the short answer is not very much has been done. There's a researcher at Harvard named Eve Valera who has done a few studies on this, and I've had some wonderful conversations with her over the last couple of years just to talk through how she goes about doing that research and how she goes about in terms of approaching and answering the questions of what are the impacts of potential traumatic brain injuries in this population. So it's certainly a different population than young contact sport athletes who might have one concussion. Typically, survivors of intimate partner violence have been exposed to likely head impacts that result in symptoms many, many times. And so it's challenging because just like in sports concussion, objectively measuring whether a concussion has occurred is difficult. It's challenging because in sports concussion, usually there's someone there to witness the injury, whereas in the privacy of someone's home, in intimate partner violence situation, typically there is no one present, or maybe the kids are present. And it's horrible to think about these things, but it is a reality. And then the other aspect that is probably different as well is that there's a lot that goes along with intimate partner violence in terms of things like post-traumatic stress disorder, anxiety, depression, potential substance use to deal with the challenges that are imposed by being in that context that typically aren't present in young hockey and football players, right? Absolutely, sometimes kids who get sports concussions will have emotional consequences of it, and it's, think about, you might be totally into hockey or football and then get this injury that makes it challenging, if not impossible, to participate in that sport for some period of time. That can be depressing. That can induce some emotional disturbances. So it's not to minimize the impact in that context, but I think in the context of intimate partner violence, there's a lot of other things going on that because of that, we have to take account of that. So there are measures, clinical measures that we can do that look at things like post-traumatic stress disorder and substance use and anxiety and depression. So we take them into account in terms of trying to characterize how much of the deficits and the symptoms that we're seeing are due specifically to the potential traumatic brain injury as opposed to any sort of emotional disturbances the person might have.
Right.
So it's work that's not being done very much anywhere. When I talk to my traumatic brain injury and concussion research colleagues across Canada about this research, they all go, "Oh, yes, of course, this is something that we need to also be studying because it's just as important, if not more so, than looking at it in the context of hockey or football."
And to be clear, like you said, with sports injuries, it could be not necessarily a direct impact to the skull, but like being thrown hard into a wall type thing by, where you hit your shoulders, but your head keeps moving, and that could create concussions as well. So bringing awareness to the topic is excellent. are there treatments for people who have these long-term effects from concussions, and can these be applied to victims of domestic partner abuse as well?
Yeah. Again, it's early days, absolutely. Certainly in terms of our own research, the main thing that we're focusing on is just the characterization of the incidents and the actual kind of direct measurements of the traumatic brain injury. Another piece that we're working on is, like you say, increasing awareness and knowledge. Yeah. So right now, at places like the Kelowna Women's Shelter, the staff aren't trained and don't have the tools at their disposal to be able to ask questions around traumatic brain injury and do referrals to brain injury specialists that could help their clients. And so that's another piece that we're looking at, is actually translating the knowledge that we're generating in the lab into tools and resources that can be used like at places like the Women's Shelter. In terms of what can be done about it, in terms of interventions and rehabilitation, I think in the longer term, referring clients to brain injury specialists, neurorehabilitation that occurs in the community anyway for people that have brain injury from other sources is probably the way to go. That's absolutely part of the mandate of places like the Women's Shelter, is to get their clients going to and making use of resources that can help them as they try to transition to a life free from abuse.
Do you publish any of these studies publicly?
Absolutely. It's you publish or perish in academia, as they say. So right now we're only a year into the study. We are just about to submit our first paper, looking just at the symptoms that we're seeing and comparing it to what we see in the contact sport athletes. But over the next year or so, we'll probably be submitting quite a few other papers looking at all the other measures that we're making. And then, like I say, another piece of the work is this translating of that knowledge into things that can actually be used in community organizations like the Kelowna Women's Shelter. Yeah. So we'll probably publish papers on that process as well. But in many ways, it's the tools and the awareness raising that are almost more important in terms of the long-term well-being of the clients.
Can you tell us, as the data starts coming in from the Women's Shelter, and I don't know if you're getting data from other women's shelters around the country or if it's just this one, but were you surprised at the data that's coming in?
Yeah. So I think probably the most surprising thing right off the bat was basically all of the participants that we've had come through the Women's Shelter and be in our study have symptoms that are consistent with traumatic brain injury. Wow. All of them, right? Wow. Now, that's not all of the clients. Obviously, we only have a subset of those clients, but still, it's remarkable and scary that it's so prevalent in this part of the population that finds themselves in this context. And that seems to go along with some of the changes in terms of brain function itself, which are very similar to what we see in contact sport athletes. So it's definitely happening in this population, is this kind of simple thing to say. And probably the more important part of it will be, what do we do with this information? How do we help improve the setting and the context so that women who've experienced intimate partner violence can get the help they need?
Just to dig a little bit deeper, is it fairly easy to get concussion-like symptoms from physical abuse, or does it have to be, a severe throwing into the wall or a hard punch to that, or is it fairly easy to get concussions from partner abuse?
Yeah, I mean, we don't have direct data on that, but I think certainly when we asked them, well, what was the mechanism, what happened in these episodes that led to this outcome, and those are the exact things that the participants will report. Another aspect that doesn't happen in a sporting setting is strangulation. Mm-hmm. So quite often that's used as a means to to implement intimate partner violence. And so that's a different way to injure the brain, I guess, is one way to look at it. You're cutting off the blood supply and therefore the oxygen to the brain. And that's potentially has different outcomes. But in the big scheme of things, the impact is the same. It's just not from a mechanical force. Instead, it's from cutting off the blood supply.
Well, Paul, thank you so much for bringing awareness to this and for all the work you're doing. And I agree with you. Awareness is the first step, because then other professors and doctors and researchers are going to hopefully find better treatments for this phenomenon, which is very common in sports. And I think as a society, we're just kind of becoming aware of it in the last 10, 15 years of I hear they've done autopsies on NFL players after they've passed away, and this is very, very common. So thank you for bringing awareness to this issue. Would you like to nominate someone to come on the show in the future?
Sure. I'd like to nominate Deanna Kent. Okay. She's an author, used to work at Disney Club Penguin, and her and her partner have just released a book for young adults, and it's a fantastic story, and I think she'd be a great guest. And she's lived in Kelowna a long time.
Paul, thank you very much for your time today.
Thanks for the opportunity.